In Ontario, there are now so many patients in some hard-hit regions. Hospitals are warning they are nearing capacity. Eric Sorensen reports on the growing strain on the system and the campaign for aggressive new restrictions.
As of now, Trillium Health Partners, 3 hospitals in Toronto and Mississauga, are at 99% capacity. Ontario has seen a spike in COVID-19 cases, and now hospitalizations are on the rise too. From 1 month ago, the number of cases has almost doubled, from over 700 per day on a 7-day average to more than 1,400 cases per day. Hospitalizations stood at 230 per day a month ago, now 459 per day this week. At Etobicoke General, they have 70 COVID patients, but another 33 who are suspected and need separate rooms that are increasingly in short supply.
The 33 suspected cases need to be in 33 separate rooms, which makes it very difficult for us.
As of now, Ontario has expanded its red zone from Toronto down to Hamilton, with restrictions on restaurants and gyms, urging people to stop getting together in groups or going out at all except when necessary.
I'm sorry for a lot of the small businesses, but it's better to have a healthy and safe community than one that the virus just is totally out of control.
One specialist says Ontario should bite the bullet and impose a sweeping lockdown, a COVID-0 approach, because half measures, he says, aren't working.
The problems with color-coded systems is that they encourage you to tolerate low levels of disease, which inevitably get out of hand. So the only way to move forward is to get control of COVID-19.
Ontario's chief medical officer is considering lockdown measures, but what to lock down? Businesses or schools or both? And hard-hit urban centres or the entire province?
What are the consequences of doing that action at this time? Are there severe consequences? Are they minor consequences? But what's the benefits, and to weigh those out and to make sure you move on them?
For the moment, Ontario's aim is to improve the numbers before Christmas so families can get together. But the Premier is also preparing Ontarians for a Christmas without big family gatherings.
We'll always have other celebrations, we'll always have other Christmases, but if the numbers continue to spike, as I said before, I won't hesitate in a heartbeat to lock things down.
The numbers in Ontario are expected to keep rising. The question is, how high will they have to go for Ontario to consider targeted or widespread lockdowns? Eric Sorensen, Global News, Toronto.